Welcome back, everybody, to the main room. Hope you've had good discussions in your breakout sessions. Unbelievably, an event on this scale that we are dead on time. So we're moving now on 25 into 25 minutes of panel discussion. So we've got some questions we're going to be posing to the panel members. I'll just give it a couple more seconds for everyone to join the main group and for all the panel members to appear on the screen, and then I'll just go around, and if you could just introduce yourselves to everybody so we know, so everybody can know who you are and where you're coming from, and then we'll go straight into the panel questions. Okay, so I think we're all here now. So I'll just go through round on my screen. Liz, then Fiona, then Harrison, and then Paul. If you could just say a few words to introduce yourself. So Liz.
Hi everybody, I'm Liz Jones. I'm the Policy Director at the National Care Forum. We're a membership organisation for not-for-profit providers of care and support. Delighted to be supporting this event. We work very closely with TLAP, and I've worked with AWOC for nearly 10 years, I've realised.
That's great, thanks Liz. Fiona?
Hi, I'm Fiona Aspinall. I'm a senior researcher at University College London. I'm also someone who's ageing without children.
Thanks, Fiona. And Harrison?
Hello, everybody. Harrison Marsh, as the background shows, I work for Alzheimer Society. I am one of the local systems influencing managers, so we work at a local level across Northern Ireland, England and Wales to influence change for people living with dementia.
Great, thanks Harrison. And finally, Paul.
Thanks, good afternoon, everybody. Paul Goulden, I'm the chair of Ageing Without Children National, and my day job is head of partnerships at the International Longevity Centre.
That's great, thank you. So a big part of today has been about getting the issues and experiences of people aging without children aired and heard and discussed, and boosting profile and raising awareness. But we also want this to be the start of something, not just a one-off event one day. And we really want to focus people's minds and on actions and what can be done to make it a more prominent issue and begin to go from understanding to taking action and making improvements. And this panel discussion is really shifting that focus, so away from the awareness raising to think much more what can be done and what needs to be done next by everyone on the panel, but also everyone joining the call as well. So we're going to look at the issue of aging without children in terms of actions, and thinking it in layers, really, in terms of what individuals can do, what can local areas or communities or communities of interest do locally, but then also have a challenge up and think about what are the implications and what are the actions that can happen at policy. So for each panel member who wants to contribute, we'll start really by thinking about what are the actions and things that people can do as individuals to begin to make a difference around some of the issues that we've heard today.
Shall I kick off?
Yeah, go for it, Paul.
So I think the first thing is the just talking about the issue and the awareness raising. So obviously AWOC started 9 years ago. Kirsty and the team there did an enormous amount of work in getting us to the point where aging without children is acknowledged as a thing, and that's a huge platform for us to be now moving forward on. I think the next step that with certainly people locally need to do is to be sort of getting that message around, explaining what the issues are, but maybe using their networks and just making sure that the whole issue gets embedded within a local community. So talking to any groups that they are involved in with our local groups, might specifically mention York and Leeds and East Kent, who are very well embedded into their local community groups infrastructure. So they are seen. So the issue is, because they are there, the issue is seen as something important as well. So I think it is about being there and being part of that, because it then gets established as more than a thing. It is part of the movement that is actually happening locally. So for individuals, it is about talking to their networks, keeping the issue alive locally, and that in itself is then a platform for change.
Thanks, Paul.
I agree with that, and I was just someone's just put some things in the chat about kind of recognition from local authorities. So obviously, from a provider perspective, I would say we are trying hard to help providers of care and support services have proper conversations about understanding the needs of people who are aging without children and understanding how best to tailor the services that they provide. But of course, it's a bit chicken and egg, isn't it? So advocacy and voice and kind of presence in a local place helps to contribute to that. It's kind of bottom up, and we can do a bit of top down. I would say also, having worked in a local authority and having worked in the civil service, getting an awareness with councillors, with MPs, actually pushing the topic with some brilliant stats. I mean, the AWOC team have got a brilliant evidence base, and it's all there ready for us to use in conversations. So there are things we can all do in our personal advocacy and our influence, and then we can help people to also use that great work to just keep having the conversation, because the cohorts of folks, we're all aging, and many of us are aging without children, and we need to be talking about it. We don't talk about aging enough. We certainly don't talk about aging without children enough. And at a recent global aging conference we ran a couple of weeks ago in Glasgow, we were inspired by the idea of the 100-year life and 100-year thinking. And that means we definitely need to think about how people age, including people who are aging without children, and what that means about our services, our system, our planning.
Lovely. Thanks, Liz. Harrison?
Just to add to and build on some of the stuff that Liz and Paul already said there. Liz had mentioned about speaking to MPs and councillors. So from our point of view, that's something that we'd encourage and look to support. And I suppose, although we're a large organisation, we couldn't do the work that we do and have the impact that we have without campaigners and our campaigners that sign up to become a campaigner and receive some of the information that we share. And with that, there are calls to action. But to make the impact and have that impact that we have through our conversations with MPs, that only comes out of the backing from local people signing up, showing that this is a major issue, speaking to their local MP and local councillors. I think a few other actions just to build on that. Meetings that are held in public as well, so health and wellbeing board meetings, people can pose questions about topics that are key, like this one. Also, integrated care systems, so the integrated care partnership and integrated care board, they meet in public as well. There's opportunities there to ask questions more at a local and system level. I think one of the other big things, the final point that we make, is just about sharing your story and the importance, the impact that has. So from our point of view, I can go into a meeting and provide all of the key data points and information and recommendations. But what really brings it to life is those stories and having campaigners and people living with any of these challenges, telling us how that impacts on their day-to-day life.
Thanks, Harrison. Paul, could you expand on that from the specific experience of aging without children? Because obviously it's been a movement and a campaign that's been going for some time, and it's been sort of going up and down, and there was times when you didn't think it could continue, and then it's got new lease of life. So clearly this isn't an issue that's new, and it's some of the issues and challenges, and people began to self-organise and come together and start to build that movement. So is there anything that you've learned over that time in terms of what people are able to do for themselves, but where the limits might be, and what others maybe on this call could do to try and sustain and encourage that movement?
Sure, I think there's a few observations. So first of all, the health and social care campaigning and influencing sphere is very, very crowded, with a lot of people shouting quite rightly about their various parts of their issues, and of course there's only a limited capacity for government to actually be listening to that. So our tactic has been very much to look at the local groups. We started off with 4. We now have 9 that are doing a range, not only a range of activities, but also the size of what they're doing as well. I think I'll come back to the point about being part of the local community infrastructure, because I think that is absolutely vital. The other thing to maybe talk about in mobilizing on a local level will be that different areas are going to want different things. So we've very much adopted this. We haven't adopted a one-size-fits-all tactic. So I hope they don't mind me mentioning them, but The AWOC York, for example, is incredibly social. They have great meetings. They carried on online during lockdown. They now have their in-person meetings. They have speakers, and that's how they've developed, and that's what they do, and that's fantastic. And they're a very vibrant group. The Leeds group, I think, is a little more information sharing and support. In terms of sourcing resources. So, and I don't think it would be appropriate to say, well, York is what we want everywhere, or Leeds. It very much is a case of what is needed locally, and of course finding those people locally who are able to actually commit the time to do that. So our end from the national is basically around, if someone wants to start a local group, then we have a resource, we can support them. Love people to come along to our monthly meetings, but I think it is around finding the what will work and working with what we've got available. And I think that's the essence. That's really the essence of how we mobilise locally. We will want people to be sort of putting their hands up and seeing if they're interested in joining or forming local groups off the back of this event. So yeah, I think it is around local people mobilising, looking at what the scenery is, looking at the local councillors and MPs, as Harrison quite rightly said, and looking what can be delivered and managing that expectation. But I think just a group existing locally will be of enormous benefit.
Thanks, Paul. Is there anything anyone else wants to add to that in terms of how we might support that local mobilisation and connection between people who want to make this issue much more prominent?
I suppose hopefully people can, I saw there was a comment just that my sound might be a little bit dodgy, so I'll sit a little bit closer. But I suppose from our point of view, something that we try and do, recognising that we cannot do everything, even the size of the team that we've got, we cannot reach every area, is ensuring that people have got the key messages, the key data points, and Liz touched upon this a little bit as well earlier. So we have a local dementia stats page, which pulls together a lot of key data points across the country for different parts of the pathway for dementia. So I think just thinking more so about organisations themselves and setting up campaigners to be able to support those calls. That's probably something that's absolutely key in making sure that the key challenges that have been faced, the data points are shared and they're available for people to then go and do their own campaigning work and mobilise as well.
Brilliant. Thanks.
I think, sorry to jump in again. I think the other thing that should be mentioned is in terms of attitude. We don't want a local group to be sitting there and just, I hate to use the phrase, whining about how terrible things are. I think they need to be part of the solutions that are at a local level as well. So
yeah,
we've got Alzheimer's on board on the call, which is fantastic. I would want a local group, if they come across someone who's aging without children and has early stages dementia, to be referring through to Alzheimer's and other support groups in the same way that local people ought to be referring through to AWOC if they find someone in that. So it's very much around meshing with that local community and being supportive and providing solutions rather than just sort of throwing bricks.
Yeah, absolutely. I think that point came certainly in the session around intersectionality in terms of this isn't about separating aging without children from everything else, even as an idea or as an individual, but equally that point you made there, Paul, in terms of if you're going to get a group together and people feel that connection around this issue, that it doesn't stop there. It needs to be knitted into the whole infrastructure and local supports. So I think it's a really key and crucial point. I'm just conscious of time. We could talk about any of these questions for a long time. But if we're going to mobilise and we're going to help and support and get people together and be solutions focused and want to make improvements and change things, one of the very earliest chat points that came up when we started this panel discussion was surely something needs to change nationally with policy. And a lot can be done individually and peer supports and informally in communities, and a lot can be done to connect into local decision making and infrastructure and commissioning and health and wellbeing boards and integrated care boards, etc., with the right appropriate support. But what I'd like to move the conversation on now is to think about what are the implications for this at a national level, and how do we connect that personal need and appetite for change with local networks and connections and mobilization? How do we then make that extra connection to really get heard at that national policy level, and to make sure when people talk about care and support and think carers, they're also thinking about people aging without carers, or any aspects of health and social care. How do we get aging without children part of that conversation on a very equal footing? And can I just link, sorry, it's already a long question, but can I link the next bit of it as well, just again, because I'm conscious of time. A key part of influencing policy, so feeding one of the answers, is clearly having the data and the arguments. So can I also think about, because again, we've heard today lots about the lack of data or inappropriate data or missing data. How can we improve the data set, and how can we begin to use that as one of the key levers? So I'll quickly summarize. How do we improve data, and how can we use that data to be much better, much more efficient at influencing national policy? So come to you, Fiona, first of all, on that one, please.
So I think probably one of the key things about collecting data is, first of all, acknowledging this population, these people who are living, growing or aging without children, people living without carers. I think there is a growing acknowledgement of that. So I'm obviously coming from a research perspective. So I think researchers are gaining interest in this, and it's something that people are starting to collect data on. So in terms of research, there's still very little, but it's starting to improve. We know that people, for example, people with dementia are often excluded from research if they don't have a carer. So we know that we don't have information about that population in general compared to other populations. But I think in terms of improving this, first of all, we've got to do the other things you've talked about, or we've got to do them hand in hand, is getting both policymakers, service providers, service commissioners, and researchers to acknowledge this population and see the importance of collecting data on them. And then we have to think about, well, not only do we have to collect this information, but how do we use it? How do we link it with other bits of information? And Alzheimer's Society are great at linking those kind of data together, but local authorities have to do that as well. And how do they do that? And I'm afraid I can't give you the answers, because we know there's lots of challenges with that. But I also know that local authorities are working very hard on that at the moment as well, trying to think about how to link different data. But certainly from most recent research that we've done, and our most recent research has been on dementia, shows that this type of information generally isn't collected. Household composition might not be collected. Living arrangements might not be collected. And this is alongside other things that aren't collected as well, of course. I'm just focusing on this. But I think as the other thing to say is, as researchers, I think our duty is to feed back to local authorities and tell them these things. So as part of the project we've been working on, as we've been talking to local authorities, we've been telling them what other local authorities are collecting. And that's made them straight away say, oh, actually, we don't collect that. I'm going to add that to our work. Or, well, we do know that information, but we're going to make it more prominent on our recording documents. That can take a long time in these processes, but getting people to acknowledge it and see how the data might be useful for them in service planning is really important. And then things that you've already talked about in terms of sometimes it's really important for individuals themselves to have the data, share with each other, talk to each other, and you've talked about that through your networks already, but that in itself can help improve planning for the future, understanding how to liaise with services, what the best mechanisms are to do that. So I think the data, as you said right at the beginning, comes at lots of different levels. It comes at the individual level to share experiences. It comes at the local level, between communities and between communities and services, and then at the regional and national levels. And I think this is where the complexity comes from. But I think we are starting to move a little bit further forward in this, but it does take time. I think there's a question in the chat, and I'll respond to that by chat rather than taking more time here.
Lovely, thank you. I think, yeah, we're not going to have all the answers today, but I think you've done a brilliant job at encapsulating some of the ways forward and things that we need to think about and engage and join up. We have about 6 minutes.
Just
Sorry.
one point. Yeah, well, I was just thinking about what Fiona said, and actually, there's something about driving it from the top, isn't there? There's something about the national approach here, and I seem to recall one of your early campaign asks was that AWOC was added as a protected characteristic to the list of characteristics that we record. And once you get things systematically into a data requirement, then it will flow back down from the top, hopefully more easily. So I do think there's something about pushing for a national data set that actually starts to find a way to identify this is a characteristic, because then that linkage of data sets is much more possible. And of course, from a provider perspective, that was one of the things we were talking about in the toolkit, along with language. Talking about language, it really matters. If you want to understand how to respond properly to the needs of people who are using your service or might want to, then understanding kind of key characteristics about them is essential, isn't it? So we can do something as providers, we can do something as individuals, and we can push for a national requirement with all those big important people, the chief statistician or whoever he is these days.
I think there is something here, but there's a sort of chicken and egg situation whereby we can't make the case nationally without the data, but we also need the data to make the case nationally. And we almost need someone to come in and maybe working with a local authority in order to get that data collection done properly, tease out some of the challenges. I know some people have been putting in the chat around the how do you ask the question in a way that actually gets the data to come through properly. So I think there is something there about, yes, making the case nationally, but also working with if there's any local authorities who are on the call, I mean, it would be great to have a conversation with them about, well, how can we get you as pathfinders on this, and then build it up from there.
Excellent, thanks, Paul. And Harrison, anything from Alzheimer's experience or lessons, maybe not aging without children necessarily, but what can you tell us and teach us about how to make inroads in taking an issue and making it prominent in terms of policy?
From a data point, there's probably a recent example for us anyway. So one of our big focuses at the moment is improving dementia diagnosis. The data is there for the diagnosis rate, but what we were missing was subtypes, so reporting on subtypes, the different types of dementia. And it wasn't that the data wasn't available, it was just not being used. So it was available in the background, but until we pushed on that point and highlighted why it was needed, particularly when we're coming up to a point where we're going to potentially have disease modifying treatments to support people with Alzheimer's in particular. Once we've made that point, that then brought home the importance of showing subtype as part of that process of reporting. And that was very much off the back of combining forces with other organisations. So there was ourselves, Parkinson's UK, Lewy Body Society, back in the summer last year, put together a bit of planning to put a letter to Steve Barclay, Secretary of Health and Social Care. Steve Barclay then put pressure on NHS England, asked questions of NHS England about data reporting, but we also then had the backing of several other charities, including Alzheimer's Research UK and Young Dementia Network, just to name a few, which just showed the consensus that we had around this position, the need for subtypes. So I think there's just a few key points. Who knows what data is available that may support anyway in painting a picture, but also combining forces, I suppose, to show the need for this data.
Brilliant, thank you. So really it's around having a really clear narrative and reason why this is important, that is strong enough to work at all those levels, so the individual, the local, and have that inroads at that national level. To have some substance to that, that's going to be of interest to national policy makers, have really clear propositions, have really clear challenges and issues, have evidence that you can point to and data that you can draw upon that reinforces those points. And the final point you made there, Harrison, around the benefit of having partners on board. So it's not just one group or one subset or a group of individuals trying to be heard amongst all the noise. It's actually saying this affects everybody. And there is some things that we can agree on, and there's consistency here, and so that policymakers get to hear the same message repeated again and again and again. And I think the other thing just to add is that that kind of influence and that kind of change doesn't happen instantly. On occasions, things combine and you make amazing inroads, but generally speaking, it is about that heavy, consistent, repetitive work and messaging. And that there is progress being made is a bigger issue. We've got events like today, for example, but also Aging Without Children is quite prominent in the House of Lords report around ordinary lives. So it is beginning to get heard. It's beginning to get a profile that hopefully things like today and the work that we hope will come from today can help sustain and mobilize. Again, we're bang on time, so I'm going to quit while we're ahead. And just to thank everybody very much for your contributions. I've not been able to follow the chat, but if it's anything like earlier, there'll be an awful lot more to go over there as well. So just to say thank you to Liz, Fiona, Harrison and Paul. Hopefully the four of you will continue to connect and talk, and hopefully through the network that we're building around today, that can become something that really takes hold, and we begin to coordinate and take coordinated action together. Okay, thank you.
Thank you.
That's almost the end today. We have another 10 minutes or so, and this is a chance really to trying to formally capture different people's views and ideas about what the next steps might be. So it's a new technology for me. I don't know if anyone else knows how to use it, but in the chat, I believe we're going to be getting a link that will take you through to a Mentimeter, and there's going to be 2 questions posed. So if we're just opening the chat, yeah, you should see that there now. So after hearing from speakers today, what do you think the priorities are for Aging Without Children to work on? Okay, so you can follow the link either by your camera on your mobile phone with the QR code here, or you can follow a link in chat. And what that will do is you'll be able to answer the question there as an individual, and then it will pull all that information or data and present that so we can all look at that in real time. Okay, so people have started to make a link, so that shows it works, which is good. Okay, so we've got the first suggestion around forward planning. Communications guidance. It's going to start picking up speed now, so I'm going to struggle. Consensus building. Pushing for data. Tackling stigma. I'm going to stop trying to read it all now and just let it do its thing. Okay, just so people who aren't familiar with word crowds, the ones that are bigger and more prominent, they're the ones that have had the most people suggesting the same or similar things.
Ian, can you hear me?
I can, yeah.
I'm thinking that there's some people who can't get onto the Menti or are choosing not to get onto the Menti either
Yes.
way. They seem to be putting their contributions into the chat.
Yeah, perfect.
I really spotted that. Sorry, I just thought I would.
Yeah, no, I've been asked to mention that. So that's my error. Thanks. Yeah, so if you can't access this or don't want to use the Mentimeter, then do just add your responses in chat. What we'll do is try and scoop those up and type them in ourselves with the tech team behind the scenes. But certainly, if we can't manage to get it into this at this point, then we will make sure that we scoop that up after the event. So yeah, do use the chat if you're not using the Mentimeter itself. Okay, well, it looks like there's plenty there for Aging Without Children to work on. And I think the key point, again, from the panel discussion of the day as a whole, that it is it's for all of us to play a part in this, and we're going to have much more impact the more that we can knit those actions and activities together. So I think something like Aging Without Children is a perfect place to sort of make the importance of the issue heard, and to be a real focus for a lot of these actions that are coming in here. But I think many of us as individuals or organisations will be looking at this about how we can play our own part and connect it all up too. Okay, what we'll do is we'll make sure we share the word cloud with everybody as part of the post event resources as well. Okay, so thank you for that for the first question. The second question is less about what Aging Without Children can do and more about a personal reflection, either yourself as an individual or group that you're involved in an organisation. What action can you personally or will you personally take away from today in terms of trying to support some of the agenda that we've been discussing? So again, use the chat, use the Mentimeter, and exactly the same thing will happen, and we'll begin to populate a word cloud around personal actions and organisational actions that we're going to contribute ourselves. Excellent. So about having conversations, searching out local groups, talking to local groups, that's bringing them into the discussions, conversations locally, absolutely. Bringing discussion with local area coordination network is really proactive point there. Raising awareness about AWOC itself, speak to colleagues, become more aware, engage with local AWOC groups, through to sort of taking more sort of campaigning, proactive actions around writing to MPs, speaking up more. A lot of talk here around connecting with colleagues and just having it as part of the conversation. Some specific stuff from some of the breakouts, I think, in terms of looking at rural transport, Aging Without Children, making sure it's part of future dementia strategies, sharing information about small and micro enterprises with colleagues, so begin to signpost service users. Small micro organisations, community catalysts, an excellent organisation to find out more about how very small organisations can really meet very individual specific local needs really effectively in personalised ways. Making sure we include them in strategies. I guess that's organisations and local, regional and national. Plan to put some keynotes from the event into a newsletter. Yes, absolutely. Everything from today will be shared and we want you to then take that further and amplify that to your own networks and colleagues. So it's good that that's come through strongly today. Support local groups development. Yeah, I think absolutely get more local groups going. And I think the point from the panel discussion as well is making sure that those local groups are also integrated and connected to other networks of support and action in local areas, and begin to sort of see less in isolation and more just a part that needs to be thought in terms of intersectionality, really strong. Look at setting up an AWOC group. So that's an excellent action. Yeah, someone said save the links to share and look back on. There's been some fantastic chat contributions and a lot of links shared. So we will make sure that we get those organised, themed and sent out to everybody as well post-event.
A strong challenge, Ian, I've been spotting is people, sorry, you didn't ask me to say, but I'm going to say.
No, chip in, yeah, come.
A strong challenge about people who are not online or not smartphone users and how so much of this stuff is moving in that direction. So
yeah,
would want to worth.
Yeah. And again, that issue, like so many, it's very relevant to Aging Without Children, but it's relevant across all sorts of different parts of policy and practice. So again, you can begin to see where we can begin to make real networks and connections across different sort of starting points. Okay, the screen stopped showing and you're back looking at me, unfortunately. So I think that means we've got the information that we need from that bit, and it's now really just for me to thank everybody who's contributed today. So it's been an absolute team effort. TLAP has hosted it, but the planning, the preparation has been a whole number of organisations, and the input from today has only been possible because of the skills and insight and learning that people are willing to share so openly and freely. So a real genuine, heartfelt thank you to everybody who's been involved in the planning and the organisation, and the tech support on something on this scale is something that TLAP haven't tried for a long time, if at all. So thank you for bearing with some of the teething and technical issues, but a massive thank you to Joe, Kira and the team behind the scenes as well. And then finally, thank you for everybody for giving up so much time today to really look at this and give it the time and attention it deserves, and for such rich contributions for the chat. So we'll certainly be in touch, and hopefully this will be the start of some more further work and partnership working to come. Okay, thank you everybody.